Next, let's discuss how machine learning can help us identify subgroups of disease and predict outcomes. Another hot term lately is machine learning. Quickly, as a review, machine learning is a subset of artificial intelligence in which computers have the ability to learn without explicitly being programmed to do so. And there are wide applications in health, although the longitudinal effectiveness in impacting outcomes remains to be seen. And there are two main branches of machine learning, supervised and unsupervised. Unsupervised is particularly useful for hypothesis generation, or perhaps when you don't have outcomes labeled. And today I'll talk about clustering specifically and how we've applied it to examine subgroups of disease. Distinguishing subtypes of disease is useful for treatment, prognosis, and understanding of disease biology. And there are many chronic diseases with a single diagnosis that actually may be representative of different subtypes of disease. And a great example is breast cancer, where tumor hormone receptor status represents a different genetic risk variance than other types of breast cancer, treatment responses, risk, and prognoses. And we can use something like clustering analysis when clinical and genetic complexity is suspected and heterogeneity of disease. And the goal is really to identify and refine definitions of subtypes based on clinical and genetic factors. And this is really a data-driven analysis and hypothesis generating. We use this technique to look at lupus specifically. So lupus is a disease with heterogeneous manifestations with a wide range of disease severity. And it's really difficult to predict long-term outcomes of patients and how they will respond to different medication. So our hope was to identify different patterns in the clinical and molecular data of these patients and identify distinct clusters, which we hope could lead to more refined and personalized treatment regimes. And at the time, those studies had integrated both genetic and clinical data from EHR to identify phenotypes using bioinformatic approaches. We took 400 patients with lupus that had both genetic data and electronic health record data. And then we extracted a genetic variance associated with lupus risk. And we combined that information with their EHR data, which included sociodemographic factors and some lupus-associated labs. And subtypes were determined using a special clustering method that accounted for the complex structure of our multi-ethnic data set. Usually genetic analyses are often restricted to one race or ethnicity due to heterogeneity, but in this method we could actually take advantage of our multi-ethnic data set because lupus is a disease that actually has a higher prevalence in non-white populations. And our clustering analysis found 3 distinct subtypes of lupus. And we also found some genetic variants that significantly interacted with the genotype cluster interactions after correction for multiple testing. So we found significant interaction with C3 lab and also RNP positivity. Now, we used a similar approach for a different cohort of lupus patients, not from EHR data, but again, we clustered these subgroups based on clinical variables. And you can see, again, we found three clusters. So this ACR criteria is criteria for lupus and ethnicity, and you can imagine including all sorts of other factors. If you have a cohort study, it doesn't have to be restricted to any one type of variable. And then we correlated these clusters with methylation differences and found that there were different methylated sites found between these 3 groups. And we were also able to validate this in a separate set of lupus cases. So this is just a great example of combining multidimensional data sets and to make something more meaningful. And our hope is to take this down the road to look at different treatment responses between these groups. So in this example, we showed the potential for merging different types of data. and using machine learning approaches. And as we move toward collecting social determinants of health in the EHR, which we're beginning to do at certain local sites, hopefully that becomes implemented nationally. These variables could also be incorporated into the machine learning models to understand more nuances of disease. And my hope is that these will help in identifying disease treatments for patients.